Joining us now, the director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci. He is chief medical advisor to President Biden. Welcome back to the show. Good to have you. So let's start where we stand with the vaccines. The president's saying that every American adult will be able to get a vaccine by May. Do you feel confident in this? And what will be the stumbling blocks to getting the country back on track through the vaccine?
Well, what the president said is that we will have enough vaccines by May to be able to vaccinate everybody. I mean, the stumbling blocks are, whenever you're dealing with as massive a program as trying to vaccinate the overwhelming majority of the country, there are a number of real and potential stumbling blocks. One is just the logistic challenge of getting the vaccine into everybody's arms. But the president had been very clear that he's doing everything that we can to be able to do that expeditiously. Community vaccine centers, mobile units to go out into poorly serviced areas, people who don't have good access, pharmacies that are going to have a lot of vaccines that people can get to, and getting vaccinators, people who will be able to put the vaccine into people's arms. For example, not only National Guard, but also retired physicians and nurses that will be called upon to come back in and do that. Those are all challenges. I believe they're going to work very well because the president is very serious about making this a very, very high priority. So hopefully when we get those vaccines, as we will by June, that the process of getting it into people's arms will be smooth. And hopefully by the time we get to the end of summer, the beginning of the fall, if we don't have too much vaccine hesitancy, which is another potential stumbling block, people being hesitant about getting vaccinated, which is one of the reasons why we're reaching out very, very proactively, particularly with groups like minority groups who have skepticism about vaccines. So we have a task ahead, but I think we're going to be able to do it.
Dr. Fauci, I remember reading last summer a story, I think it was the Miami Herald, but a story about how Florida residents, despite bad advice they were getting from their statewide office holders, were self-distancing by themselves, were using masks more than their leaders had suggested they should. And this article was saying it explained why some communities actually were doing well. With that in mind, I'm curious what advice you have for the good people of Texas and the good people of Mississippi who maybe be given some bad information right now by the leaders of their state.
You know, my strong advice to them, Joe, would be to actually continue to implement the public health measures. Now is not the time to pull back. The good news is that we have vaccines coming online. You saw the curve of the infections per day coming down. But over the last 7 days or so, we've reached a bit of a plateau where the deflection of the curve isn't going straight down the way it was. That's a bad sign. We've seen that before. We've seen that last summer when we were trying to so-called open up the economy and open up the country, when we said there were certain guidelines that you should adhere to. And as you know, there was variable adherence to those guidelines. And then we had that really big surge that we don't want to repeat now. I mean, we were going in the right direction. Now's the time to keep the foot on the accelerator and not pull off, because the thing that we don't want is yet again another surge. So I would advise the people of Texas and Mississippi to just abide by the public health measures that we talk about all the time: uniform wearing of masks, physical distancing, avoiding congregate settings, particularly indoors, washing your hands frequently. We just have to keep doing that because we know it works.
Dr. Fauci, good morning. It's Willie Geist. Good to see you again. I want to ask you about schools because, as you know, the crisis of this last year extends far beyond public health. It's in our schools now. You have a full year. There's reports that 3 million kids have not been contacted over the last year, have not reported into school. Kids without resources, who don't have Wi-Fi, who don't have laptops, who just aren't going to school for a full year. That has implications for education, but also now pediatricians are talking about the psychological impact of being out of school for a year. You have said schools ought to reopen if they can do so safely. The head of the CDC, Dr. Walensky, has said the same. So why are schools not open, in your judgment?
Yeah, of course, there are several reasons. It's complicated. It's just not easy, open or shut. There are several issues. First of all, you want to make sure that the first and the most important thing is to guarantee the safety and the health of the children, of the teachers, and other people in the educational program. We've got to make sure that the schools have the resources to do the kinds of things they need to do, which would be making sure they have masks and PPE, making sure that the ventilation system can be improved to be able to diminish the likelihood that there'll be spread of infection. The CDC guidelines are pretty explicit. It's a detailed guidelines about what you can do, the kinds of things you can do, the steps, the masking, the distancing, the kinds of things that we know can help protect the children and the teachers. Importantly, the president has made it very clear that we want to make teachers a high priority among essential workers. In the 1B component of the prioritization are essential workers. We want to make sure that teachers for vaccination are a high priority within that group. We don't feel that it is a sine qua non. Absolutely every single teacher needs to be vaccinated before you get back to school, but we certainly want to make them a priority. All of those things, plus the resources that the schools need to be able to do the things that would make it safe for the children and the teachers and the educational program to be there. So there are a lot of things that we could do to do that. But to repeat what we've all said, the default position should always be do whatever we can to get the children back to school.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.